Whenever you're asked to prescribe for a patient, or indeed alter a prescription that's already been issued, it's important that you do this in the context of the whole prescribing picture, and you need to look at the drug chart to get an idea about this. So if you're in a patient's record, then you need the left-hand menu, and you have two choices. You can either look at the drug chart, or in practice, many doctors actually find the drug chart summary a more useful and more intuitive view to interpret. There's a few things to appreciate. Firstly, in the grey banner bar at the top of the drug chart, you will notice that it has defaulted to the time period the 14th to the 17th of September. But this patient was actually admitted on the 12th of September. So we're not seeing the full picture. If we want to go further back, we can right click on this bar and change the properties. And you'll see that I can go further back save that, and now I have more days in view. You can also change the default views and how the drug chart summary will appear here. The second thing to look at is what's displayed in this box here. So currently I'm seeing all medications in the system. So that will be all medication for this encounter that was prescribed, regardless of whether it's completed, discontinued, or ongoing. You have other options. So for example, you may only want to see the active medications in the system. So do be aware what you've got selected there. And then finally, in this box here, we'll see that the drug chart summary defaults to a time view. You can have other views. If you hover on this little box here with a blue arrow pointing to the right, you get show views. If you click this, then as well as the time view, i.e. I see drugs sorted by whether they're scheduled or PRN, I have the option for a route view. And so if I wanted to, I can just review intravenous medications. Or I can see everything. And then another useful view is the therapeutic class. So this will sort all the drugs on the drug chart into the appropriate classes. And you'll only see the classes of drugs that the patient's on. So if I want to review antibiotic treatment, I can click here and know that I'm looking at all prescriptions for any anti-infective drugs. Similarly, if I want to review respiratory agents, I can do that. You can drill further down into these, and that happens. This patient's just the only respiratory agents this patient on is on bronchodilators, but if they were on other respiratory agents, they would sort them out here. So particularly when you've got a patient on a lot of drugs, this can be really helpful when you're doing a drug chart review. So 3 things to think about there: the date range, the medication view, and the chart view. Now that you know your way around the drug chart, you should be able to feel confident that you have all the relevant information to hand when you need to prescribe or alter prescriptions, and we're going to look at that in the next video.